Hi guys, my name is KP Balan. As some of you guys know me from my previous videos in my YouTube channel. I'd like to first of all take a moment and thank you all for the positive remarks and the words of encouragement that you guys have provided me for my videos. And thank you for subscribing to my videos. It really means a lot and it's a great motivation. I know it's been a while since I've made a video, so today I was just looking through the videos in the last couple of weeks and noticed that there's a pattern about a lot of people asking me about specialist training and having to do the AMC exams again. So I thought, hey, it's time for another video. So here goes. So today we're going to talk about basic physician's training. So that is basically to get into general medicine and the specialities that general medicine can offer. Apart from that, this is also similar for pediatrics. So let's get started. Now, before I do start, I do want to kind of highlight I'm not a BPT trainee and I also don't do BPT interviews and I've also not applied for the BPT training program. I am actually an ED registrar and I'm a service medical registrar as well. So just to point out there, I'm not a BPT trainee. So all the information that is here today is from the RACP website. So you are more than welcome to visit the website to learn more about the opportunities and the options that you guys have. At the end of this presentation, I have put all the links where I found my resources from the details of my resources from. And this PowerPoint will be also uploaded on my Facebook group for your reference. All right. So just to make things a bit easy for you guys. All right. So BPT training programs are open at the moment. So those of you guys are eligible, let's look into it a little bit. Okay. So what is BPT training program? BPT stands for Basic Physicians Training. All right. So what that means is that that's including adults and pediatrics. So overall, the basic physicians training includes 6 years full time. So if you are going part time, please do keep in mind that it can be a bit longer. Now, currently, there's no entry exams for the RACP training program. So, how it works is that you first have to I'll talk about the eligibility. You have to check your eligibility first. And once you're eligible, you will submit your CV to the college. Once your CV has been read and you've seen that you're eligible, the hospital will provide you with the interview and you have to go through the interview process. All right. So let's look at the eligibility a little bit so that gives you a better idea if you're a candidate that can apply. So first and foremost, if you're an IMG, you must pass AMC Part 1 and Part 2 clinical exams and you must have completed your year where you've completed a year with provisional registration and have gotten your general registration. All right. Once that is done, of course, it is automatically understood that you have completed your intern year successfully and also you're employed by an accredited hospital. Okay, so if you're in other states, please do check out what are the other hospitals that are accredited for the basic physician's training and for pediatrics. And make sure, and then your CV will be discussed for approval with the director of physician education. All right. So what this means here in WA, if you're at Stanley, Charlie Gardner's and Royal Perth are the accredited hospitals for basic physicians training. For pediatrics, it is the Royal Perth Children's Hospital. The Perth Children's Hospital. All right. So these are so you have to be employed by these accredited hospitals, and then you also must have the other criteria for your eligibility in order to be successful with the application process. All right. So moving on, what does BPT provide? So it's as you can see, there's so many specialities once you finish your basic training that you can go into advanced training too. And some of them are dual specialties, so you could do two of them together. And you can, so for example, you might need micro and infectious diseases together, and path and hematology together. So things like that can be worked out. So I've provided a link for this page. I know it's very cluttered, so I have provided a link at the end of this presentation for you guys for referral. Take a look and see if there's a specialty that does pique your interest and that you can venture out into and will make your career all the more enlightening. All right. So moving on, As you can see, it's very small to read. I put that at the end of the presentation. All right. So before you enter, you need to know a bit about your fee structure as well. So as you guys know, there was a bit of a hike in pay hike or fees hike in 2022. So basic and advanced training, you they have increased it by about $50 from 3,646 to $3,690. Now, don't worry about the post fellow annual training. It's also out of the scope of this video, so don't worry about that at the moment. Then the other fees that you have to consider is your examination fees. So you have your written and your clinical, which is 2,031 and 3,417. Now again, all of this can be found on the website, so do check it out. All right. Now, what happens once you're done with the training or once you become an advanced trainee? So, basic trainees are permitted to enroll in advanced training within 5 years of completing the basic training. The eligibility depends on the completion of all the requirements of the training. All right. So, it depends on how if you're eligible or not based on the requirements that you have completed. And when you successfully complete your advanced training, the overseeing committee will recommend you to the for the admission to the fellowship for you to become a fellow at the end of the entire training. All right. So, what does this mean to the overseas doctors? So, there are a couple of terminologies that I'll be using. So, I've put it out here. So, overseas trained physicians are physicians that are recognized specialists back in their country that are looking to work here. Then you have top up training, which means that the overseas trained physicians are assessed as partially comparable and may need to undertake further training in Australia. Okay, and then peer review means a period of practice where an overseas trained physician is reviewed by at least two RACP fellows for about 12 months or more. Okay. So, so who are OTPs? So, if you're looking to register and practice in Australia in adults or pediatric medicine, you must complete the specialist assessment. And before you complete the specialist assessment, you must see if you're eligible. So, what does that mean? You must hold a specialist qualification back in your country, and you must provide evidence of current and previous registrations in that particular specialty that you wish to join. All right. And if you have less than 4 years of accredited overseas specialist training, then you need to at least show and you need at least 3 years of consultant experience at the level of an Australian trained specialist. Okay. So if you're less than 4 years of consultant experience in that particular specialty, you need at least 3 years of consultant experience overall at the level of an Australian trained specialist. Okay. And if you have limited experience as at consultant physician or pediatrician level, you need at least 4 years accredited overseas specialist training. Okay. So that means if you don't have consultant experience of at least 4 years, you need at least 4 years of accredited specialty training. All right. I know it can be a bit confusing, so do check it out a couple of times. It might be worth the while. And also go check out the website. I'll put the link at the end of this presentation. Okay. So, what does STT mean? This is another option for other trainees. So, these are specialists in training and that are looking to upskill in the specialty in that particular area just for a short term. All right. And we'll talk about this about a bit more detail in a bit. Now, I just want to clarify that this does not mean that you're in the RACP fellowship program. All right. Now, if you have any doubts regarding this, please do call the RACP directly. They do have their contact information on their website, and I have that at the end of the presentation again. All right. So, what does what does the short-term specialist training mean? So, what that means is basically it allows IMGs who are qualified specialists or are specialists in training. So, when I say qualified specialists, they're specialists that don't have the number of years of consultant experience in that specialty, but are qualified and completed your training. Or if you're completing your training at the moment as we speak, you can undertake up to 24 months of training here in that particular specialty in Australia. Okay. Now, I do want to make two things very important in that. This does not mean that you're going to be permanently working here. This does mean that you will be going back to your home country, back to the job that you were in. This is just to complete that, get a bit of experience here in that field. And also, this does not mean that it's accredited by the RACP, and it does not mean that you're in the fellowship college or training program. Okay, it does not. It also is not a criteria for the is not an eligibility criteria for the RACP training program. Okay, this is very important because it's a common misconception, and I don't want that to be there. Okay, so please pay attention to regarding this pathway, and please pay attention when you apply. You must be okay that you might need to return back home unless you can secure a job here. Now, who are eligible for this? If say you want to just come here for a bit of experience, well, you are basically applying into the limited registration for for a training position, and it'll be supervised. All right, and they're recognized by qualified specialists in other countries. And also, you are eligible if you're a specialist in another outside of Australia, and you have more than 2 years of training left to go to before completing your training, and you've also passed your basic specialist examination. So here it translates to PGY 5, or generally more than 3 years of experience. Okay, so that means you've at least completed some sort of basic training back in your home country. So, for example, it would mean in India, it would mean that you've completed MD and you're looking to train in cardiology. So, if that's the case, then the MD would be a basic, and you've had 3 years of experience, and you're coming to just get a bit of experience in cardiology. Okay, so that's just an example of what that means. Now, I'd like to point out that you can contact RACP for help and guidance to see if you're eligible or not. But again, these are some things that RACP does not answer and cannot assist you with. And the ones I've highlighted are the ones that have already been asked to me as a question in my video. So I thought I'd just kind of highlight that for you guys. They don't talk about registration matters or the English requirements. English requirements are basically just for your registration. It is not for eligibility into the college. And also, they don't check, they cannot tell you if your college will pass a primary source verification. So that is very important for you to realize. Okay, and also they cannot advise you on the pathway that is best suited for you, if it's competent, if it's standard, or is a specialist pathway. They wouldn't be able to advise you on that. Okay, so do your homework. Those pathway informations can be found in my other videos, and also it's also on the Opera website. All right, moving on, so that this video is not too long. I'd like to just point out that these are the links that I was talking to you about earlier. I've kind of put a heading to them as well, just to help you guys a little bit. If you have any questions, don't hesitate to put your comments in the comment section below. I'd love to hear your thoughts. And also check out the links if you have further questions. See if you're eligible, and do give RACP a call, okay? But just don't bombard them with just questions. Do your homework before you do give them a call, okay? Well, thank you guys. Thank you for staying tuned and following me on YouTube. I hope to hear more from you guys and please do let me know if I've helped you in any way. I would love to know about your journey. All right. Bye for now.